This video is dedicated to everyone who has ever had a heart stent placed or is preparing to get one. And I truly hope you will stay until the very end, because what I'm about to share may completely change the way you think about stents. If you've had a stent placed or you know someone who has, have you ever wondered how long that stent will actually last? You see, most people leave the hospital after the procedure feeling safe, thinking, my artery has been fixed. I'll be healthy for the rest of my life. But what if I told you that's not exactly true? Because while a stent can absolutely save your life in an emergency, it does not guarantee lifelong protection. The truth is, most people are never told that the real story behind a stent's durability is far more complicated than they think. Which leads us to the big question, how long does a stent actually last? And that's why in today's video, I'm going to break it all down for you so you'll have the knowledge you need before a stent becomes part of your body. The best part, I'm saving it for the end of the video. So stay with me, watch until the last second, and don't miss anything. What you learn here may become incredibly valuable during your treatment and your journey with a heart stent. Before we dive deeper, make sure to hit the like button and subscribe if you want clear, honest explanations about heart health and the latest breakthroughs in cardiology. And let me know where you're watching from in the comments. I love seeing where my viewers are tuning in from. What exactly is a stent? First, let's simplify the nature of a stent. A stent is an ultra-tiny metal mesh tube that is placed inside a coronary artery to keep it open so blood can flow freely to the heart muscle. When an artery becomes narrowed or blocked by plaque, the heart muscle lacks oxygen, causing chest pain and potentially leading to a heart attack. Balloon angioplasty can temporarily widen the artery, but without a stent, it can quickly narrow again. That's why the stent acts like a permanent support frame, stabilizing the treated artery. Think of it as scaffolding inside your artery. When your artery is narrowed by plaque, doctors inflate a small balloon to push the plaque aside and then insert the stent to ensure the artery doesn't collapse again. There are two main types of stents. Bare metal stents, BMS, the first type used in the early 1990s. Drug-eluting stents, DES, more advanced stents that slowly release medication to prevent restenosis, re-narrowing. Today, most modern hospitals only use drug-eluting stents because they significantly reduce the risk of the artery becoming blocked again. But does that mean they last forever? Not exactly. So how long does a stent actually last in your body? Here's the truth. Stents are designed to be permanent. They stay inside your artery for life. They don't dissolve or disappear. However, and this is what most people are unaware of, the effectiveness of a stent doesn't always last forever. Why? Because over time, the artery wall may grow tissue around or even inside the stent, a process known as neointimal hyperplasia. When this happens, the artery may begin to narrow again. According to the Journal of the American Heart Association, 2022, about 10% to 15% of patients may experience restenosis within the first 5 years, even with a drug-eluting stent. That means out of every 100 people who receive a stent, around 10 to 15 may have the same artery become narrowed again over time. And that's not all. Some patients may develop new blockages in completely different arteries, which means the underlying disease atherosclerosis is still active. So yes, the metal stent remains forever, but the artery surrounding it does not. That's the critical difference many people overlook. And this is something doctors often don't fully explain. When a stent is placed, especially in an emergency like a heart attack, the goal is to save your life, not give you a long lesson about arterial biology. But once you recover, you deserve to know these hidden truths. First, it is necessary to clearly understand that a stent is not a magic cure for heart disease. It only fixes one single narrowed spot in a long and complex coronary artery system. You can imagine, if the coronary artery is a long pipe measured in meters, then the stent only treats a few millimeters. The remaining sections are still affected by cholesterol, chronic inflammation, high blood pressure, high blood sugar, and aging. Therefore, even if the stent works perfectly, you can still develop new plaque in other areas and face the risk of future blockages. This is clearly demonstrated in the COURAGE study, one of the largest clinical trials on stable coronary artery disease. The results showed that in patients with stable angina, placing a stent does not prolong life and does not reduce the risk of heart attack better than only treating with medication and lifestyle changes. This surprises many people, but it reflects the true nature of heart disease. It is a systemic disease, not a single blockage disease. This does not mean that a stent is useless. On the contrary, in dangerous situations, such as an acute heart attack, a stent can restore blood flow within minutes and save the patient's life immediately. However, after overcoming the crisis, the responsibility for protecting the heart returns to you. Controlling LDL, quitting smoking, treating diabetes, exercising, and eating healthy. In other words, the stent only solves the emergency part. The lifespan of your heart depends on what you do after leaving the hospital. Second, restenosis is not only dangerous but also very silent. This is the reason many people become careless. In the early stage, the body does not send out strong signals because the artery narrows little by little, just enough to reduce blood flow, but not enough to cause clear pain. You can still move normally, continue daily activities, and believe that you are completely fine. But inside, new tissue is slowly growing into the vessel, or plaque is continuing to develop in the nearby area. When the artery becomes narrowed by about 70% or more, only then will symptoms appear such as chest tightness, quick fatigue, shortness of breath when climbing stairs, and pain spreading to the shoulder or jaw. And unfortunately, many people only recognize it when the symptoms are already obvious, which means restenosis has progressed to a severe level. Third, antiplatelet medication is not optional, it is mandatory for anyone who has had a stent placed. Even if you feel healthy, even if you think the stent is stable, you still must maintain the medication exactly as prescribed. Aspirin, clopidogrel, or similar drugs have the role of preventing platelets from sticking together and forming blood clots inside the stent. If you stop the medication suddenly, even for a few days, the risk of stent thrombosis will rise sharply. This is the most dangerous type of blockage because it happens suddenly, without warning, and can cause an acute heart attack. Some cases may even lead to death within minutes if not treated in time. That is why doctors always emphasize, a stent can save you once, but medication is what helps you live a long life. According to the New England Journal of Medicine in 2019, stent thrombosis can occur after many months, even many years, if medication is stopped suddenly. The actual lifespan of a stent is divided by type. Let's take a detailed look. Bare metal stents, BMS. They were common in the 1990s and early 2000s. They have a higher risk of restenosis, about 20% to 30% in the first year. However, if you get through that first year, they can remain stable for a long time. First-generation drug-eluting stents, introduced in the early 2000s, were a breakthrough, but they had some problems with long-term safety. Studies such as Sirius and Taxus 4 showed that the rate of coronary restenosis was significantly reduced, only 5% to 10% in the first few years. However, some of these early drug-coated stents cause very late stent thrombosis, sometimes later than 3 to 5 years. Second and third generation stents today are much safer and more durable. They are made with biocompatible polymers and improved drugs such as everolimus or zodorolimus. Data from the Excelsior Registry in 2021 shows that the recurrence rate after 5 years is only below 2% to 3%. Very impressive. But remember, the success of a stent still depends on your lifestyle, medications, and the control of your risk factors. What actually determines how long your stent will work? Let's look at the main factors that determine how long your stent will remain effective. First, smoking. Smoking increases the rate of arterial inflammation and blood clot formation. If you continue to smoke after getting a stent, your risk of stent thrombosis can double in the first year. Second, diabetes. According to the Journal of Diabetes and Vascular Disease Research, diabetic patients have smaller arteries and more aggressive plaque buildup, which reduces the lifespan of the stent. Third, cholesterol levels. High LDL cholesterol damages the artery walls and leads to plaque formation. Statin therapy. That's right. These cholesterol-lowering medications can significantly reduce the recurrence rate. Fourth, blood pressure. Chronic high blood pressure puts stress on the artery walls and creates small tears, which can make plaque grow worse. Fifth, treatment adherence. Stopping blood thinners or statins for even just a few days can reverse months of recovery progress. Sixth, diet and physical activity. Studies like Dean Ornish's cardiovascular lifestyle trials show that positive lifestyle changes, plant-based diet, exercise, and stress reduction can even reverse early plaque buildup. That means even if you already have a stent, your lifestyle still determines whether you will need another one. Here is something most people have never heard about: stent fatigue. Over many years, your arteries and the metal stent continuously interact with blood flow and vascular movement. In a small number of cases, tiny cracks or fractures may appear in the stent struts. These changes can lead to abnormal tissue growth or clot formation. A study in the European Heart Journal showed that these structural changes are more likely to occur in longer or overlapping stents, especially in arteries that bend or move a lot, such as the right coronary artery. That is why cardiologists nowadays aim to use the shortest stent possible and avoid placing multiple stents unless absolutely necessary. There is a question I have received quite often recently. Can a stent be removed or replaced? This is a question that many people wonder about, and I know you are one of them. Once a stent is implanted, it does not need to be removed. It becomes part of the artery wall as tissue grows over it. If a stent becomes restenotic, doctors have two main options: repeat angioplasty to reopen the blockage, and sometimes place another stent inside the old one. Coronary artery bypass graft surgery, CABG, if the area is too complex or has been blocked many times. There is also new research into bioresorbable scaffolds, designed to dissolve over time and allow the artery to regain elasticity. However, earlier versions had a high failure rate. The absorb trials showed that these bioresorbable scaffolds have a higher risk of thrombosis compared to metal stents. The newest generation of stents is being improved, but they are still not widely used. So how can your stent last as long as possible? Here's the good news. You can control the operating time of your stent better than you think. Below is a checklist that every stent patient should follow. Take your medication regularly. Even if you feel completely healthy, continue taking your medication as prescribed. Never stop your medication without the approval of your cardiologist. Never smoke again. Just one cigarette can trigger platelet activation and increase the risk of blood clots. Follow a Mediterranean diet, rich in olive oil, fish, vegetables, nuts, and whole grains. The Predime study proved that this diet helps reduce more than 30% of cardiovascular events. To apply the Mediterranean diet in the simplest way, you can start with familiar dishes but prepared in a healthier way. For example, breakfast can be a slice of whole grain bread with olive oil and a few slices of avocado, plus a bit of smoked salmon or boiled eggs to add heart-healthy protein. For lunch, you can try a large salad with leafy greens, tomatoes, cucumbers, olives, and a tablespoon of extra virgin olive oil, served with grilled fish such as salmon, mackerel, or sardines, fish rich in omega-3 that help reduce vessel inflammation and protect blood vessels. For dinner, you can choose lentil soup or white bean soup cooked with vegetables, a meal that is light yet rich in fiber, which naturally lowers cholesterol. If you want something different, you can make whole grain pasta with sautéed vegetables, a few walnuts or almonds, and a tablespoon of olive oil. All of these dishes follow the principle of pre-dimed: high fiber, healthy fats, low sugar, and low red meat, helping arteries stay clean and significantly reducing the risk of restenosis after stent placement. Exercise regularly, at least 30 minutes per day, 5 days a week at a moderate pace. Control diabetes and cholesterol. These two factors affect your lifespan the most. Schedule regular checkups. Ask your cardiologist about non-invasive tests such as stress tests, echocardiograms, or CT angiography if you experience new symptoms. Next, what happens to you after 10 or 20 years? Now let's talk about the long term. Do stents really last 20 years? The answer is the metal stent does, but the condition of your arteries determines whether it still functions or not. There are patients who have lived 25 years with a well-placed stent without any problems, and others who needed a second procedure within 3 years. A long-term study from the Mayo Clinic showed that after 15 years of stent placement, nearly 40% of patients had undergone another coronary procedure, but not always in the same location, often due to disease progression elsewhere. Therefore, the lesson is very simple. A stent is not the endpoint. It is the starting point of a lifelong commitment to heart health. Now, I want to speak directly to you. If you have ever had a stent placed, you may feel both relieved and afraid. Relieved because your artery is open again, but afraid of what will happen if it becomes blocked again. That fear is completely understandable. But here is the truth your doctor may not have had time to explain. The lifespan of your stent depends on biology, but it also depends on your daily choices. What you eat, how you move, how you manage stress, all of these can help extend the effectiveness of your stent far beyond the average. You do not need to live in constant worry. You just need to live with awareness. Researchers are now developing polymer-free stents to reduce long-term inflammation. Magnesium-based bioresorbable scaffolds will disappear once healing is complete. Smart stents can monitor blood flow and transmit data wirelessly. Yes, this is real research highlighted in Nature Biomedical Engineering, 2023. Therefore, in the next decade, we may reach a point where stents not only open arteries but also Therefore, in the next decade, we may reach a point where stents not only open arteries, but also communicate with doctors in real time. So, how long does a stent last? Technically, for life. In reality, that depends on you. A stent lasts forever, but your health choices determine whether it continues to perform its function. Doctors often do not explain this in detail, not because they are hiding anything, but because the focus is on saving your life in the moment. But once that is done, you must protect your heart for decades to come. My final advice, if you have any problem related to your stent or heart, go to the nearest clinic or hospital for examination and follow-up, and follow your doctor's instructions. If you found this analysis helpful, remember to like this video, subscribe, and turn on notifications. I share deep, evidence-based explanations about heart health that you can't get from a quick medical visit. And before you leave, tell me in the comments, how long has it been since you had your stent placed? And what changes have you made to protect your heart since then? Remember, the stent saved your life once. Now it's your turn to extend that life. Thank you for watching and see you in the next videos.